That takes us to message number 4. This is the information review text. This is done 24 hours after that first visit, and this comes straight out of the research. Just like Straight Outta Compton was a great movie, this is straight out of research. In 2018, in the Endocrine Journal, Williams and Junction, I apologize if I'm mispronouncing that name, they found that patients leaving a diabetic clinic that had their initial description of foot care, super important in diabetes care, 50% of them had the message wrong after just talking to the doctor. They had the message wrong when leaving the office. Already 50% of them were incorrect. 24 hours later, 80% of them had the wrong information and were not properly educated on how to do the care. They had forgotten it. They misremembered it. They totally forgot points. And this is with those doctors reading off a 5-point bullet point script. The doctors are saying the same thing every time. Patients just weren't remembering it. So what can you do? Well, you can send your patients a message 24 hours after their visit, right? So we've already set up some messages beforehand. We set a night of message saying, I just want to check in and see how you're doing. Now, 24 hours later, we're going to do the information review. Dear Mr. So-and-so, I just want to check in. Here's what we found yesterday. Here's our plan moving forward. You are going to A, B, and C, and you are going to come in for your visit this day, and this day. Very simple information. Now, you might be worried about HIPAA, all right? HIPAA compliance here. So a couple details there. Trust-driven care, our software is completely HIPAA compliant, but there is no software that does text messages that we can say is HIPAA compliant because text messages themselves cannot be HIPAA compliant. So what do? Well, it's easy. If we get permission from the patient, we can send them any information we want via any method. We just have to let them know, and they have to opt into it. If we send it without their knowledge or without their consent, then we have a HIPAA violation, regardless of the method you send it. But if the patient consents to receiving text messages from you, which a lot of them will, in fact, in my experience, all of them will. I've never had anybody tell me, no, I don't want to get that. Then it is, in fact, HIPAA compliant because HIPAA relies on the patient's consent. That's the keystone in the whole situation. If they consent, it works well. So 24 hours later, maybe you want to wait 48 hours and say, here's what we found. Here's what you're going to do as a patient. Here's what we're going to do as a provider. And let's get moving forward on this. The great news here is we see that the research says that the information starts falling off. And at 24 hours, it's pretty low, right? But if we send them that reminder between 24 and 48 hours, the information retention actually goes up higher than it ever was to start with. So if it started here, it dips down and it ends up here. That reminder seems to not just remind us, but actually bolster and improve our information retention. Try it with anything. If you're a mental health provider and you assign a couple in marriage counseling, a couple skills or maybe an assignment to go on a date together, reminding of them that 24 to 48 hours later will actually improve their retention and improve their memory of it more so than the initial assignment. It's incredible, and all it takes is scheduling a text message.